The average insurance-based primary care provider in the US takes care of 2,500 to 3,000 patients. They have no idea who you are. And we treat them like human beings. Shocking. That is a real thing.
Hi, this is Ken Renner here at Santa Rita Ranch, the host of Santa Rita Ranch Health and Wellness Expo. And I'm here with Monica, and she is a nurse practitioner that owns an amazing practice right outside our community here. It's called Impact Family Wellness. And it's an alternative to your normal medical doctor situation and insurance situation that you're used to. And so we're going to talk about what she does and what she does different, and who her excellent patients are going to do, or perfect patient point. So
Absolutely.
So Monica, tell us how long you've been doing this, and what's the plan?
Sure. Well, thanks for having me, Ken. So I own Impact Family Wellness. We are a direct primary care office. So that means we are membership-based, not insurance-dependent. So we take patients with or without insurance, and we treat them like human beings. Shocking. That is a real thing. And so our office is much like Netflix for your doctor or affordable concierge. So for under $100 a month, you can come in as many times as you want. There's no copay. There's no office visit fee. There's not a credit card machine at our office. And you get to build an actual relationship with your healthcare provider, somebody who knows your name, who actually cares, who will pick up the phone. You can get an appointment the same day. Shocker. You can even schedule it online. You don't have to call us. But ultimately, we're here to take care of human beings. You can use your insurance for things outside of our office, but I'm not here to allow your insurance company to dictate how we take care of you. Because turns out insurance companies are not in the world of healthcare. They're in the world of taking care of their bottom line. And so they like to tell us what we can and cannot do, which is not typically in the best interest of the patient. And so, yeah, that's what we do.
They like to practice in healthcare because they like to work as doctor, don't they? Tell them the right medications they're going to allow you to prescribe and things like that. We are totally frustrated as self-employed real estate broker here in Liberty Hill, for many, many years of paying $1,700 to $2,200 a month and not getting anything covered. I'm able to pick up the phone and call him at 8 o'clock at Miami Answers. He really does care, and he takes the time to explain the how to get out, what it is. And same thing with you, to be able to explain what it is rather than what's the length of the average doctor appointment?
So in the US, the average primary care office is about 7 minutes. And I'm going to tell you, your provider doesn't know your name yet. They're still reviewing your chart, trying to figure out who you are. Because unless you're a complete pain in the butt, your primary care provider doesn't know who you are. The average insurance-based primary care provider in the US takes care of 2,500 to 3,000 patients. They have no idea who you are. We're in our office, we limit to, no one can take more than 50 patients. And so we actually know their names. We had a relationship with them. So when you do send me a text message, I'm not like, Ken, who's Ken? Oh yeah, Ken has this, this, and this. We should do, instead it's like, oh yeah, it's Ken. Yep, this is his annual sinus infection every March. So this is what we do, right? And so when you're able to build that rapport with your patients, they really do trust you. And then they will text us or call us for their problems instead of asking the world of social media. I am mind blown by the number of health questions that we see on moms groups. Don't get me wrong, they're great to have as friends. They're great to ask who you should call to be your plumber. But when you're talking about your kid's rash, you should be able to call somebody that you know to trust. And unfortunately, our healthcare system doesn't allow for that. And so we get rid of a lot of mom guilt. I think that's one of our number one selling points is moms feel guilty because their kid says their ear hurts. Well, here's your options. You can call your pediatrician, might get an appointment in 4 days? By then your kid might be dead, who knows? So then you take them, do I take them to urgent care and sit in a gross waiting room for 3 hours and pay $175 for something to look in their ear and say, oh, Johnny's fine, actually. And then 24 hours, he gets worse. You call back the urgent care and they say, yeah, you'll have to come in again. That's awful, especially as a mom. You have so much other stuff going on. And so when it's like, oh, Johnny's complaining his ear hurts, send us a text. Hey, his ear hurts. Can I get in? Yeah, bring him on up. We say in 15 minutes. You're in and out. And then guess what? If Johnny gets worse tomorrow, you can just text us or bring him back. And so we do that follow-up. Every one of our patients that comes in with some sort of acute situation, we send them a follow-up text 24 to 48 hours later just to check in on them because it's what they should do. Our healthcare system is really broken in this world. And so we're the fix for it.
Well, so we had that conversation before, is the how broken the insurance system is, and I don't think I've never met a doctor who said, "Oh, I love the insurance industry." I have a whole other staff to handle, another employee just to handle the insurance stuff, and they spend more time doing that, dealing with those problems, than they do covering patients.
Yes.
And even when they're like, our dentist is a great dentist, we can scare them from anybody, insurance. It's like, how frustrating. We as a consumer also are very frustrated. Like you said, I just say that to my $200 a month, sorry, you're 35 years old, I'd have probably $1 million in, cash that I can have.
Yeah. Don't get me wrong. There's a time and place for health insurance, right? We do all the primary and urgent care stuff. So we can manage, 70 to 85% of people's healthcare needs. What I can't do is take out your appendix or fix your arm that's like in half, right? And so there is a time and a place where health insurance can be helpful. If you get a cancer diagnosis, I sure hope you have health insurance. Otherwise, you're going to go bankrupt in this country because it's so expensive. But they're all that day-to-day stuff, those like little rashes or fevers, or I'm just not feeling well, or I need my thyroid medicine rebuilt. That's not what your insurance is here for. Unfortunately, health insurance was meant to be more like your car insurance, where it doesn't take care of your oil changes and your gas and your tires. It's there for when crack hits the fan. But now, even then, our insurance companies don't want help with that. And it's just so...
It's getting worse.
Absolutely. And so we just try to make things easy. When you take out the barriers, right? You're not going to sit in our waiting room for any amount of time. You know that you're going to be seen. You're going to get all of your things taken care of. We can do your annual physical, check your blood pressure, and take off a mole all in the same day, and it's not going to cost you any extra. And so when you take out, or when you add in price transparency and a relationship, it makes healthcare easy.
Yeah, and that's what you're saying. A lot of times, even people would not even go to the doctor. They got an ailment, they're like, I know I spent this hassle.
Especially men.
Yeah,
You guys are the worst.
I know that.
The worst.
Yes, I mean, if I'm not bleeding out, then I'll already be fine. But
You don't know how long it's going to take. You don't know who you're talking to. You don't know if you can trust them. And then they're going to send you a bill in 3 to 6 months for whatever they want, and you can't do anything about it. We teach people to be good consumers for everything except for the one thing that matters the most, which is their health. You go to Starbucks and they had a list of how much things cost, and you can make the best decision of what you want and what you're willing to pay. Yet in healthcare, it's like, well, we can't tell you what that's going to cost. You're just going to have to trust us on this one. And then you get $2,000 bills. It's insane what we expect to do.
And then the things you can do, you can also prescribe by telemed, right?
Absolutely. So we do probably 70% of what we do via text message, right? There's a time and a place I have to touch a patient. I can't do a pap smear from afar. I can't do a COVID test from afar. But if you've been on the same blood pressure medicine for the last 6 years, you've been checking your blood pressure at home, just send me a text so we can have that conversation here. Of course, we want to see our patients in the office at least once a year, but we ask our patients who don't even live in the area. They live in Houston or Odessa because they just understand the value that we bring. It limits some of the things we could do, right? So I can't look easily in the ear from that far away. But they appreciate the value of being able to pick up the phone and do a telehealth visit and just how other things have been care of.
So, and where are your locations at?
Sure, yeah. So we have one in the Set 29 building right over here by Santa Maria Ranch. We have one about 12 miles south on Parmer, when it turns into Parmer off of Ronald Reagan, secondly Cedar Park location.
Okay.
And then we have one out east, a little just to the east of Taylor in a little town called Thorndale. So for all those rural people out there who have to drive 50 miles to get to Round Drop, where the next closest healthcare place.
Urgent care, by the
There's some in Hutto now as well, but especially those that are in that Cameron, Rockdale, Thorndale, there's just nothing out there except for us. You're there?
Now I'm budget serving there.
Yeah.
No, 2,300 patients.
Let's see, we have over 2,300 patients. We've been in business about 7 years, and we had 8 nurse practitioners that currently.
And it's growing.
Care about people every day. Yes, every day we get new people. Yeah.
And either I can hear from her what your practitioners.
Yes.
Molly.
Molly Black.
Yeah. So, and I sold Molly Black her house over here at Santa Maria.
Right. Your neighbor can be your healthcare provider. Molly's great. She was the most recent and actually the last.
Oh yeah, our risers.
Nope. We are good where we are, and this is part of that reason is I don't want to become ARC or Baylor Scott and White.
No.
Could we grow bigger and faster and stronger and do all the things that we Americans are supposed to do? Absolutely. but I never want to lose that hometown feeling. I always want our patients to walk in and know that they are not a number. The people there know who they are. And so, yeah, we have room for about 850 more patients between all three of our offices, and then we're going to go to a wait list. And so if you're thinking about it, you better do it fast because it's not going to last long.
Wow, that's amazing. You know, as I've heard many times, healthy things grow.
Yeah.
So you're gonna get that point where like the tree is full of fruit.
Right.
So it's just time to enjoy the harvest.
Absolutely.
Well, we appreciate you coming over here, and also appreciate you joining us for the Santa Rita Health and Wealth Expo, which is going to be on June 15th, Saturday, here at the Ranch House in Santa Rita Ranch. It's going to be from 10 to 1. And are you going to be here?
I will not be here, but the lovely Molly will see me in the slam.
Of Santa Rita Ranch. She and Justin were great to work with. It's great when she was the first call. She called me, she saw it, she goes, "Oh, you've got to do this." So
Yeah.
And like the other thing is that she is in the what's the game Vista 29.
Yep.
And there's no signage because they don't allow it for her. So it's right on where much waffles are, and
Yep.
and so that's a great place to at the UPS store over here. So very convenient, and it's a real honor to have you a part of that. Thank you for being a gold sponsor.
Absolutely. Okay, thank you for having me.
All right, Monica, nice to meet you.
Thank you.
We'll see you on our 13th.
Sounds good.